liaison here at the Allen County Department of Health. As I'm talking, if you would like to, or if you're able to, I can't always see when people are waiting in the waiting room. So please feel free to admit them if you see it before I do. So we'll go ahead and get started. So we do have a guest speaker that's going to be joining us today from SCAN. SCAN is rebranding, so we'll talk about that. But we're also going to be talking about Project Adam, and I'm going to give you some updates on norovirus. If you have any questions as we go through, please put them in the chat or just save them for the end for me, and we'll try to leave at least a few minutes at the end for questions. All right, so again, this is our itinerary for the day. It is projected we should end right at 1:30. So I know most of you, especially the people on the call so far, already know me, but as the school liaison, I just want to make sure that I'm getting you the resources that you need. So my email address will be on the next slide, but if you would like copies of what we're talking about in this meeting, please put your email address in the chat now. I'm only going to be sending resources out and copies of the slides to people that ask for them. In terms of what I can do for you here at the Department of Health, I am your primary point of contact for anything public health related in the schools. So if you're ever unsure on something, please reach out to me. You can call me, text me. My cell phone number is the second number listed there, or you can send me an email. I do a lot of in-school programming. I'm always growing that with new classes. So I've been very busy lately with lots of classes in the schools. So if you'd like to schedule something, please shoot me an email. We can get that on the books. All of our courses are always free to any of the schools. So our online resources are growing. Our Public Health Student Hero program is ever evolving. Each month we have new deliverables available. So those are all on our county website. So there's a link in the slides, but if you just look up Allen County Department of Health schools, it'll take you there. And lastly, we are still doing free CPR, Stop the Bleed, Safe Babysitter, and Catch My Breath training. So those are for both students and staff. So if you ever want to get any of those scheduled, please give me a few weeks notice, especially for CPR, but we can get those scheduled for you. All right, and then this is just showing you what all is on our webpage. And I apologize, I'm trying to admit people as they're coming in, so thank you. All right, the first thing I wanted to talk to you about, I was made aware of this program through Parkview. Parkview is not putting it on, but they are supporting it. So schools should have AEDs, especially near a gym. If you have an AED, it's really important that you maintain it. So just having the AED isn't enough. Project Adam is a completely free program they're offering to schools, and it helps you not only know where it's the best place to have an AED in your school, but they help train all of your staff. So I know every 2 years when people get their CPR certifications, we do review AED. They can come in and retrain people, do it more frequently. It doesn't take as long as a CPR class. They also help you make a plan for understanding how often you should be replacing batteries, stocking new pads. A horrible scenario would be if you needed an AED and you grabbed it and the batteries were dead. So feel free to reach out. That's their direct email address if you want to reach out to Project Adam directly with IU Health. But Angela at Parkview said that she's very familiar with the program and she would be more than happy to help anyone who has questions. So this is just sort of an overview for Project Adam. Their goal is to make heart-safe schools. So if you would like to reach out, I highly recommend it. I do a lot of AED training with my CPR courses, but if you're only hearing that information every 2 years, it's really easy to forget. So kind of brushing up your staff, letting them know how to use the AED, how to maintain it, especially if you're having turnover within the schools. So there's different types of AEDs. They're stored in different places. Being heart safe just means knowing more about your AED than just where it is. All right, we have a few updates for communicable diseases. So first, I want to make sure that all of our schools have a copy of the Communicable Disease Reference Guide from IDOH. This is a free resource. It's online, so I can send you the PDF. You're welcome to print it. But this is an excellent resource that everybody should have in their schools. So I'm sure the school nurses have it, but if you are from a school that does not have a school nurse and you have either a secretary or an administrator running your school health program, absolutely you should have a copy of this available to you. It'll have a red stop sign if there's a certain disease that is reportable. That means if there's a case, you do need to let us know. But it also has a number of appendixes, so things like live animals in schools. If you have questions about the public health side of, classroom pets, This is a great resource for you. So if you would like that, I would be happy to send you the link so you guys can print your own copy. We have been getting a lot of questions about the 20% rule. So I just wanted to briefly touch on this. We are in the heart of cold, flu, norovirus, kind of everything season. So if you are seeing a large number of students out, if you are approaching 20% of the students in a single building, I would definitely recommend you reach out to us. Once you hit 20%, you do need to reach out to us, and then we can assess whether or not it is an active outbreak. If you do reach outbreak status, and we're going to specifically talk about norovirus later today, then we can give you more tools. We can help you on what steps should be taken during an outbreak situation. But I would definitely let your attendance secretary or anyone who's running that know if you are approaching 20% absenteeism. You should be notifying us, and then we can walk you through the next steps if it does count as an outbreak. So these resources were put out by the State Health Department I believe it was last school year. It's their guidance on when parents should keep their kids home from school. They're both very informative, but it's a lot of information. So what we did is we went ahead and condensed that down into one infographic. So it's all based on the information from IDOH. But what it does, it just tells parents, if your child is meeting this symptom or this level of severity, you really should keep them home. That has, our logo on there so they know that this is a trustworthy source. I do have this in English, Burmese, and Spanish. So this is one of the resources I'm going to send out after the call. So we give these out on magnets, something that we've created with them. So we give those out at different events. But please feel free to take this PDF, print as many copies as you'd like, share it on your social media pages. We want to make sure parents know that there is a time and a place to keep their kids home to hopefully not be meeting that 20%. We want to reduce the spread as much as possible. All right, so we are specifically going to talk about norovirus a little bit. We did cover this at the summer learning program last year, but I wanted to just go over this again. We are seeing a lot of norovirus cases all across the US. So if you're seeing norovirus in your school and you're not sure what to do, you can always refer back to these slides. So what we're seeing, there is a newer strain of norovirus. It's making up about 70% of the cases across the US. It is a highly virulent strain. It's spreading really, really easily. So as of right now, and again, this data is from December. We aren't able to get fully up to date for January right now. So this is based off of December. But these are the highest levels we've seen for norovirus cases since 2012. If you look at the number of outbreaks, it's the highest we've seen from between 2012 and 2020, and then also 21 through 24. So this is a bad norovirus season. Just a quick recap. I know we have a lot of nurses on the call, so I won't spend a lot of time on this, but what norovirus actually is it's the leading cause of gastroenteritis in the US. It's highly contagious. It mostly spreads through stool and vomit, and it's spread person to person or by touching surfaces. So there's no long-term immunity here. So you absolutely can get norovirus multiple times in the same year. And what's problematic is about 30% of the cases are asymptomatic. So people, if they're not washing their hands properly after going to the bathroom, are spreading it and they don't know they're sick. Individual cases of norovirus are not reportable. So if you get one student in your school with confirmed norovirus, we do not need to know. But if you meet the outbreak status, and I'll go over that in the next couple slides, we do need to know. Some confusion with norovirus is there's a lot of misnomers with it. So oftentimes people will call this the flu. The stomach flu and influenza are two entirely different illnesses. So typically norovirus is going to be called the flu, and it's a GI issue. It's vomiting, diarrhea, things like that. Influenza is more respiratory. Also, this is a leading cause of food poisoning, but it's not the only one. So not all norovirus is caused from food poisoning, and not all food poisoning is from norovirus. So if you've had norovirus before, I'm sure you remember it. It's not pleasant. It is a very fast-acting illness. So you start to get sick within 12 to 48 hours of exposure. It's acute nausea, diarrhea, vomiting. Sometimes there is a low-grade fever, severe stomach cramps, and headache. The biggest risk here is going to be dehydration. So really little kids or elderly people are going to be the most at risk. The good news is it's self-limiting. So usually the symptoms end within 1 to 3 days. And there is no specific treatment for it. So you just have to manage the symptoms and get through it. The technical definition for an outbreak, so this is what you would find if you looked in that disease reference guide, is if you have 2 cases of norovirus in your school that have an epidemiological link. Now, oftentimes when kids get sick, they're not getting tested to confirm it's norovirus. It's just sort of assumed. So if people aren't getting tested to confirm it, the other way we can confirm an outbreak is if 20% of the school is out with norovirus-like illness. So what to do is if you are at 20% or if you're getting close to that number, please give us a call. The number there is the direct line for our infectious disease team. You'll speak to Laura Weaver, or you're always welcome to just call me directly. And if you're not sure, we would rather you overreact than underreact. So if you're at 15, 16%, and you're not sure what to do, please just call us and we can give you the guidance on what we'd like you to do next. So during an outbreak, some steps for schools just to be aware of is any students that have these symptoms should not come back to school until they've been completely symptom-free for at least 24 hours. It's up to the school, but we would recommend waiting for 48 hours just to be sure. If you have a kid at school who is sick, so someone actively vomiting or having diarrhea, do your best to isolate them. This is extremely contagious. So if they're vomiting in a trash can in a classroom, it can actually aerosolize and it can stick to all the different surfaces or the other students sitting nearby. So do your best to get these kids isolated. And if you have any food handlers at your school, so that's people that are handing out lunch, maybe people that hand out snacks at the end of the day, they should not be anywhere near any of the food if they have any GI symptoms. So make sure to let your staff know that. For prevention, PPE is really important as best you can. I know it's hard as a teacher. If you have a child that's actively vomiting, do your best to put on gloves. If you have a mask, that's great. But you want to try to limit touching the surfaces that could have been contaminated. You also we recommend postponing large gatherings. You want to try to limit people in the school if you know that there's some norovirus cases. This also can spread through pools. So if you are a school that has, swim meets or different pool events, we would recommend not having those events right now during an outbreak. And you do not want to allow any homemade food items at all in the school. So if kids are bringing in cookies from home, anything like that, normally we don't recommend that anyway, but especially during norovirus season, if we don't know how that food was handled and we don't know if it was cooked properly. So please do not allow homemade food. And if you have fresh produce in the school, make sure it's washed thoroughly and all food should be getting cooked at the highest possible temperature. Those measures should be taken for at least 3 days, if not a full week after you believe the outbreak is over. Hand washing is your number one defense here. I know we can say it till we're blue in the face with kids, but we really need to reiterate how important hand washing is. You need to educate the kids that hand sanitizer is ineffective against norovirus. So the way that this spreads, again, is mostly through stool. So if a child gets something on their hands and does not properly wash their hands with soap and water for 20 seconds, there's a very good likelihood that everything else they're touching that day is now contaminated. We also recommend putting signs. I'm going to show you some examples. Put signs up to educate the kids, not only in the bathrooms, but also in the lunch line. So let them know that they should be washing their hands before they touch any food. So I've made a few different posters. I'm going to send these with the resources at the end of the call. So these are just a few that I've made. The CDC also has some. This is one showing how easily it is to spread norovirus, and people think that they don't have fecal matter on their hands, but it can get picked up in many different places. So again, there's many resources online. I'll send you the few that I have available. And specifically, cleaning for norovirus can be difficult. It is a very, very hardy virus. So it can survive below freezing and up to 140 degrees. So if your school quick steams their food, norovirus can survive that temperature. It also can survive in up to 10 parts per million of chlorine. So to give you a reference, most drinking water is 0.5 to 2 parts per million. So it can absolutely survive in water. And it can remain on surfaces to be picked up by anyone for up to 2 weeks. So use PPE when you're cleaning up surfaces. So bathrooms are going to be your main concern here, or classrooms where students have been vomiting. Make sure you're wearing gloves. Make sure you're using proper cleaners. So they recommend disinfecting with a chlorine bleach solution, but a lot of schools will not use those. So just make sure whatever EPA registered cleaner you're using specifically says that it will kill norovirus, because this is a tough one to kill. When you're sanitizing, their recommendation during an outbreak is hourly. I know that's really difficult in a school setting. So letting teachers know, maybe wipe down desks and chairs in between each class. You're looking for high touch areas, so like pin pads in a lunchroom, vending machines, bathroom stalls, the actual little handles inside the stall doors. Try to get those cleaned as much as possible. And just look around. Any hard surface in a room where a child has vomited is at risk of being contaminated. All right. And I was right at the 15-minute mark. So we have Christy Robbins on the call. I just saw she unmuted. So Christy is the Director of Community Partners at what you're probably familiar as SCAN. SCAN is going through a rebranding, so she's going to talk about that. It is now the Iris Family Support Center. And Christy is going to walk you through the different resources that SCAN has, how they can help you as a school health worker. And at the end, we should have about 3 or 4 minutes left for questions. Christy, can you hear me okay?
Yes, I can. Can you hear me?
I can. All right, I'm going to go ahead and stop sharing, and then you are welcome to take it away.
Yes, thank you. Welcome, everybody. I appreciate everybody allowing SCAN to come to your presentation. Like Mary said, we are now Iris Family Support Center. As of January 15th, we officially changed our name. So if you're not familiar with SCAN, we've been around for 50 years. This 2024, we celebrated our 50th anniversary. And so we have expanded to 165 employees, 41 different counties, and we've expanded our services to the point where we have a wide range of services to prepare parents, protect children, educate the community and families. And so that goes in line with changing our name to be more inclusive to a lot of different populations. If you're familiar with SCAN, it stands for Stop Child Abuse and Neglect, and that tended to be a barrier for families wanting to work with an agency when they weren't necessarily dealing with abuse or neglect or Department of Child Services. And so we're excited that our name change will be more inclusive to anyone coming to our agency to want any type of services as it revolves around families and children. And so Iris is signature to the purple that is already in our color scheme where it was at SCAN, but it symbolizes courage, hope, wisdom our staff and clients embody daily. And it's a symbol of clarity and insight, like the iris of your eye. The iris flower is a perennial that comes back every year. So that's a little bit about our name change. So I'm just going to go through our PowerPoint a little bit about what our mission statement is. Hopefully you can see my PowerPoint. Our main mission is to protect children, prepare parents, strengthen families, and educate the community. So I'm just going to walk a little bit about what all Iris offers to the community and specifically to you as school educators. So we have a full continuum of services. We have community services, we intervene with families, and we have different family connections services. So there's a place for everybody, whether it's a parenting class, our community services go out and educate into the community. We go into your school system. So if you've seen us in your school, we're doing our body indicators, body safety, bullying. We have cyber safety curriculum that we can go into the school, LGBTQ. And we've even created other curriculum based on need, like human trafficking. We do a lot of community education around child abuse and neglect indicators. If you're not sure how to make a hotline call or what to look for, we definitely can meet with your teachers and staff members, as well as we go into different agencies and corporations just to teach the community about indicators of abuse and neglect. Our intervention services are more of those services where DCS is already involved. So it might be a supervised parenting at our office or in the home, or just reunification home-based services to get that family unit back together. And then our Family Connections programs offers parenting classes. So we have some high conflict classes, mediation, as well as just a 5-series parenting class that we can have here. We do have that in Allen County, and we're talking about different expansion into other counties, but I know this group is primarily Allen County. And we also have our Family Resource Center, which is located in the 06 zip code, which is the highest need here in Allen County. And that's located at the Bridge of Grace center on Gaywood. And so that is an open center that anyone can come in and just get some resources and really target that high need population. So I'm getting ahead of myself a little bit. Um, so just a little background about IRIS. We were founded, like I said, 50 years ago, and we serve 41 counties. We are a nonprofit organization, but in 2023, we've reached 45,000 individuals through just a variety of the services that I briefly talked about there. So our community services, these are more of our prevention services. Healthy Families, if you're familiar, targets those young prenatal and new moms, birth to 3. That's a home-based program that any family can be involved with. Enrollment in their 0 to 3 month birth of that new baby, and it can be home-based up to 3 years. So it's a great preventative program. I talked a little bit about our prevention outreach of going into the schools and teaching in the community just on a variety of topics. And we have a whole menu. I think Gina sent that to you, Mary, of different topics that your agency or your schools can choose. And so if you're interested in something coming into your schools to either your students or teachers, we have a whole menu that you can choose from, and we can set that up and get in there whenever you want. And again, our Family Resource Center in the 06 zip code. Our intervention services, these are some of the ones I was mentioning that DCS is involved. You know, we have home-based casework, the family preservation, fatherhood, and visitation facilitation. Those are all referred by the Department of Child Services when DCS is involved, either removes a child or they're staying involved with the family as an open CHINS, child in need of services. But we also offer clinical services. So if you ever have a family or a child that needs counseling, we accept insurance and Medicaid as well. So that is here at our Fort Wayne office. So if you've got any child, couples counseling, family counseling, adult counseling, we do it all. So you're more than welcome to go to our website and make that referral for counseling. I am personally from Community Partners. I'm the director of Community Partners. And so if you've heard of that, that's a free and voluntary home-based program. So if you have any family who just needs that extra support, we're a case management program up to 6 months of services. We can go into the home and meet with that family and figure out what those barriers are and make goals with the family to help the family. We connect them to a lot of resources as well. So for your school population, you might see those kiddos that have, chronic lice, bed bugs being brought to school, home conditions you're concerned about, wondering about, homelessness, the things that you're hearing adults and kids talk about in their home, whether it's domestic violence, housing instability, financial instability. We do a lot of financial and parenting, money management. Those are probably our top ones. The parenting and just financial instability is causing a lot of stressors in the family with their housing instability. And so we go into the home and try to help them bridge that gap. And we want to have a good relationship with the school as well. So if you do make a referral, it's best for us if you talk to the parent that you're making that referral. So the family is not getting a cold call from us that someone reported them or, sent a referral. We want to make sure that that relationship is strong with our community partner staff, with the school, whoever that is, whether it's the teacher, the nurse, the guidance counselor, whoever that is, so that we can coordinate and collaborate and make sure that that kid comes to school and is healthy, happy, and safe. Our Family Connections program, those are some of the parenting classes. We have high conflict, like I was saying. A parenting class is more of a 5-week session. We have domestic violence services for both the batterer and the abuser, the batterer and the victim, sorry. So we have both of those. So if you come across families who are dealing with those high trauma situations, whether it's domestic violence, divorce, separation, just conflict, family conflict, we do have that counseling. And we will figure out what they need. You just make the referral. and we will contact the family and decide whether they need child, family, individual, couples counseling, and we might be able to refer them to a parenting class if the family's not interested in the counseling. The parenting classes are here in Fort Wayne at our office. However, community partners can also do that one-on-one parenting in the home. So if you have a parent who has transportation issues, childcare issues, they really can't get to the Fort Wayne office. Our community partners is home based, so we do parenting curriculum. We have different evidence-based curriculum that we use. 24/7 Dads is specifically focused towards our dads. There's a mom component to that, to show the importance of fathers in their children's lives. And then we also we use like nurturing parenting. And we have different curriculum that we use with our families. So those are most of the services. We also have partner agencies. Chill is our Creating Hope, Instilling Life lessons over on Home Avenue. We have apartments there for kids who are aging out of foster care. It's a younger population that they can get case management support while being self-sufficient and have a lower rent, but they get that case management. And then if you're familiar with our Dr. Bill Lewis Center for Children, this is where the Child Advocacy Center would interview children when sexual abuse happens and allegations are happening in the home. And so we oversee that center as well. So some of our special initiatives, I need to change my presenting. Hold on a second. I apologize. This is not my PowerPoint. So I am filling in here for someone who called in sick like 1 hour ago. So you can hold on a second. Let me get to
You're doing great, Christy. We appreciate you joining.
I've been here for decades, so I know our programs, but I don't know her PowerPoint. So I just want to make sure I don't miss something. Okay, let me make sure I'm at. Okay. So some of our housing initiatives, we partner with AWS, if you're familiar with AWS Foundation, to support 14 different homes designed for individuals with disabilities. So we support those tenants on their journey toward home ownership, financial stability, offering concrete support and case management. And then we're also the charter agency for Prevent Child Abuse Indiana, and that's for all, if you're familiar with DCS regions, that's 6 counties in the Northeast Indiana. We cover eight counties where we're the charter. So definitely Allen County and any surrounding counties: DeKalb, Noble, Steuben, LaGrange, Whitley, Huntington, and then Miami. So if you are interested in being, that is open to the public and community to just be a part of preventing child abuse. So if you were interested in any of those counties, if you're from any of those counties or specifically Allen, please reach out and we can get you on board with attending those monthly meetings. They're not always monthly, but so that's kind of everything in a nutshell. Does anybody have any questions? I have our contact information there too. My name is Christy Robbins. I did drop my email in the chat. So if you have any specific questions or want to sign up for any type of training coming to your schools, you can definitely shoot me an email, or even Mary, if she's the known contact, she can let us know too.
Yeah, thank you so much for your presentation, Christy. That was excellent.
You're welcome. You're welcome.
I'm very familiar with Iris, and I feel like I learned something. So
good.
Does anyone have any questions for either me or for Christy? You're welcome to put them in the chat, or you can unmute. And while I'm sure people are coming up with some questions, please remember, if you would like a copy of the slides and all the resources for today, I do need you to put your email in the chat. I'll be sending that out later today. And then this recording will get posted onto our YouTube channel, as well as the school outreach page for the health department. We are ending right about on time. We have another few seconds if anybody has questions. Still see some emails coming in. One last note that I just wanted to share with everyone. If you are part of a district, or if you're part of a group that has a virtual school, On March 13th, I have put together, we're going to be doing a virtual student health screening event. It'll be entirely free, except if they need to get any additional vaccines, that'll go through insurance. So on March 13th at SuperShot, we're going to be doing vision, hearing, dental, and lead screening, as well as immunizations. So if you have a virtual school, it's only virtual kids and it's only those that reside in Allen County. Feel free to message me and I can send you additional information on that. All right. Well, thank you, everybody. If there's no questions, I'll go ahead and let you guys go. And Christy, thank you again for being our guest speaker today.
You're welcome. Thank you.
All right. Thanks, everyone.